Hello. This is the second week of 290. So far, class is going great. It's not as overwhelming as it was the first week because I know now we do have a lot of courses. A lot of coursework to do, and I use a calendar and a checklist to check everything off in the calendar to make sure that I've done everything that I need to do and whatnot. So everything's falling into place, I believe, and clinical starts for me in another 2 weeks. So I did want to discuss about another moment where I was doing patient care or patient-centered care. I do believe, as someone who is a home health nurse, I already incorporate a lot of that in my care already as it is. But an example would be when I was learning how to do the chest tube. And the RN before me was teaching me how, because I needed to know how to do a chest tube. I've never done before, but it was a good experience to learn. I was able to just do the procedure, and I learned why this patient needed the chest tube to be emptied. And she's an older patient, and she lives with her family, and the family has deficit knowledge. So it's up to me as a nurse to learn how to do the chest tube care. So she had me watch her do it a few times, and then she supervised me doing it to the point where I didn't need the RN to supervise me anymore, and I was able to do the chest tube. The patient was relieved each time the tube was empty because she's not she's not feeling uncomfortable from all that fluid that's collected from the tube, and she's breathing better. Right. So before I'm doing all the procedure, I'm documenting her respiratory rate, listening to her lung sounds. I'm doing a respiratory assessment before and after I'm doing the procedure, and she always felt better each time the chest tube care was performed and it was drained. So it made me a better nurse because I was able to learn how to do what I was supposed to do and why I was doing what I was supposed to do for this patient. But unfortunately, I wasn't able to take care of this patient for long, so I had to teach another nurse how to do chest tube care. She was new to it. She wasn't sure how to. So just like the RN taught me, I taught the nurse how to do this. I was teaching her to empty the chest tube, the proper procedure, and the patient was very appreciative of the care, which was great. It was wonderful to be able to help this patient breathe a little better because she couldn't do this independently, and neither could her family. So it's important before going to a home, if you don't know the skills you're supposed to perform, to get help and ask the supervisor or any nurse that knows how to do this skill. So it was really nice to be able to help this nurse out and pass on the knowledge. Would I do this again? Yes. So as a home care, we're exposed to different kinds of skills like IV, wound care, just different sorts, like even cast, or just different sorts of care. So if I'm not familiar with some sort of service I'm supposed to do for this patient, I would always ask the supervisors if they can send a nurse out that's able to help me or walk me through. I would YouTube the specialized skill I'm supposed to do before I see the patient, because I was able to learn different skills, and it's going to make me a better nurse because I'm going to walk in confidently and know what to do when taking care of this patient. So that's my aim, and that's something I'd like to continue to do as an RN and going forth in my career as a home health nurse. Anyways, thank you for listening, and have a good one. Bye.